This is Wes Comfort with Heart to Heart International. We just got back into Slovakia from Ukraine. Our last day in Ukraine, we met with a local organization that was giving us reports of their last 10 days where they had toured some of the hardest hit areas near Kyiv and on the front lines. And as we sat down for our meetings with them, the air raid sirens went off in the country, and the restaurant owner where we were at invited us into the restaurant's basement where we sheltered for about 90 minutes. We learned, continued to learn that this process is a lot more complicated, or this problem is a lot more complicated than most that Heart to Heart responds to. Since the crisis began on the 24th of February, there's been more than 5 million Ukrainians who have left Ukraine and are in the surrounding countries, and those individuals have one level of need. You've got people in West Ukraine who are from East Ukraine who don't want to leave the country yet, but they are IDPs, they're internally displaced people, and the healthcare infrastructure in that area is a bit overwhelmed, and they have a certain level of needs. There's needs on the eastern side of Ukraine in cities like Kyiv that were once under occupation and once the front lines of the battle that are no longer, that are working on rebuilding and working on caring for the people that are still there. They have specific medical needs. You've got people who are in current conflict areas, and they have a very specific medical need. And you also have people in areas like Lviv, or like where we were, that haven't seen conflict, but they're preparing for conflict, preparing for the worst, and they have stockpile and medical needs as well. With these complex logistical and medical challenges, our partnerships are extremely important, like the one with our Irish NGO friends from the Gorta Group.
Ray Jordan, Chief Executive of the Gorta Group. I'm here in Slovakia. The purpose of this presentation today is to sincerely thank Heart to Heart International and all of their supporters for the tremendous support they're giving the people of Ukraine during this conflict. We're working as a team in terms of sourcing medical supplies, the distribution, logistics and transportation of them into Ukraine. But to be perfectly honest, it's a very fluid situation here on the ground. We spent the last 2 days meeting government officials, Ministry of Health, different non-government organizations, and really learning about the situation throughout Ukraine. There are 40 million people inside in Ukraine doing an incredible job of carrying on as normal as they can, while at the same time tackling this great war that has been thrust upon them. Little did we ever think or ever even imagine that we would be responding to a humanitarian crisis of this size and scale within the European context. You can only be inspired by the courage and the integrity of all of the people that we've met over the last 60 plus days.
Yeah, so my name is Susanna. I'm a medical doctor working with Step-In for the last 7 years, and we are working in the humanitarian field, focusing on the providing healthcare services to displaced population, to people affected by war. So we have just returned from the assessment in the Ukraine. This is going to help enormously because majority of the needs which were defined by clinics, hospitals in the Ukraine were actually medicine and medical supplies, what they need. So all these supplies will go to the hospitals and health centers which are following the front line basically. So from Chernihiv to Sumy, Kharkiv, and down to Dnipro, Zaporozhye. It's very hard to get the supply in, but there are ways. So that's what we would like to try also to do. So the places which were occupied, now they are liberated, and you see all this destruction, and suddenly there was this one house which was almost completely destroyed, and in front of that house it was an old man sitting in a little chair with all those trees blooming now in the spring, and I don't know, this image just stuck in my mind, and that's the image I brought with myself back from Ukraine.